So I want to start now with the autopsy of Christine before we move on to the baby. How tall was Christine?
Okay, at this point, if I may, I'd like to just refer to the autopsy report so that I can make sure I give these numbers accurately.
And I'll just check if there's any objection to that now. Okay, please.
So Ms. Falzone was 5 feet 1 inches tall, or 155 centimeters.
And how much did she weigh?
139 pounds, which is 63 kilograms.
As part of your autopsy, did that include both an external and an internal examination of Christine?
Yes, it did.
Is it fair to say that an external examination involves you viewing the outside of the body to document any injuries you can see on the outside?
Yes, the external exam is exactly what it sounds like. It is what I can see and document and measure before any surgical type incisions are made into the body.
And we're going to go into more detail as we walk through what you documented in a minute, but I want to make sure we have a few terms clear first. What is blunt force trauma?
Blunt force trauma refers to a very broad class of injury that generally involves either an individual being struck by something, with something, or the individual striking something relatively immobile. So if somebody, for example, was slammed into a wall or a countertop or something like that, that would cause blunt force trauma, as would punches, kicks, blows from a weapon. Those would all cause what I would subsequently describe as blunt force trauma or blunt force injuries.
What is a contusion?
A contusion is basically just a slightly fancier word for a bruise.
And when a person has a contusion or a bruise, is the discoloration on that person's skin that we see because blood has now moved to that area of the body?
It's not so much that it's moved to that area so much as the trauma causes seepage of blood outside the vascular system and collecting of that blood beneath the skin, and we visually perceive that as a bruise, but it is because of blood collecting in response to the injury.
And through your observation and examinations of bruises, are you able to tell how long ago a bruise happened, to date it in any way?
Sort of is the honest and simplest answer. Certainly not with the level of specificity and precision that some TV shows might have one believe, or that police and lawyers might want me to be able to do. There are certain broad characteristics, and at this stage in my career, I basically think of bruises or contusions as either being fairly fresh appearing, i.e. they occurred relatively recently prior to that patient's death, or a little bit older with some signs of healing having occurred. But within each of those categories, dating them more precisely is just not really, it's just not doable. So I can't differentiate whether a bruise occurred 5 minutes prior to a patient's death, or say 90 minutes or 3 hours. They're all going to look the same to me, whether grossly or even microscopically, if a microscopic exam were to be performed.
And you mentioned the sort of best you can do to separate is fresher or older and healing. What do you start to see when a bruise is older and healing that would differentiate that for you?
The coloration starts to change. So this is something that has been studied over the years by forensic pathologists, because it has relevance, right, in these kinds of legal settings. And what we know is that once you start to see some greenish to yellowish discoloration in a bruise grossly, i.e. with the naked eye, if you can start to see that greenish to yellow discoloration, you can feel pretty confident the bruise is at least 18 to 24 hours old. Beyond that, or more precise than that, again, not really doable based on my understanding of the literature and my practice over the years.
So is it fair to say that if you're seeing that green color and stages of healing, that 18 hours is sort of the cutoff? So if you're not seeing that, you couldn't tell if it happened 5 minutes ago or 17 hours ago, but it's likely beyond that.
That's the general idea, yes.
What is a laceration?
A laceration is another type of blunt force type injury, so it's caused by the same kinds of things that cause contusions, those same mechanisms of injury, but now a laceration is instead a shearing type of injury. So it's essentially tearing of tissue as a result of blunt force trauma, and the trauma essentially exceeding the tensile strength of that tissue. So oftentimes lacerations will be visible externally because they happen at the skin surface or on the head or on the face, but you can actually have lacerations as well in some cases. So it's just a tearing or shearing type of injury.
During your external examination of Christine, did you observe numerous bruises and lacerations all over her body?
Yes.
So I want to start to walk through those findings with you now, and we'll go from top of the body down. So we'll start with the head.
Okay.
What injuries did you observe to Christine's head?
So again, just for the record, I'm looking at my report because you don't memorize this kind of thing in my line of work. You rely on your notes and your documentation, but she has an abrasion on her forehead on the left side. She has contusions going around each the left and the right eye. There's a bruise on her left cheek. There are lacerations on both the upper and lower lip mucosa. That's the kind of inner soft part of the lips. And then she had four discrete areas of bruising to the undersurface of the scalp. So basically on the underside of the head. Well, sorry, you said external, didn't you?
I did. But
Sorry.
My next question was, were there any internal
Sorry.
injuries to Christine's head?
Sorry, yes, there were. Sorry, my report's organized by body region, not external versus internal. So yes, there were four discrete areas of bruising to the undersurface of the scalp. So to be clear, these were not injuries that I could see externally, but internally when I looked at the undersurface of the scalp, which is exactly what it sounds like. It's the under part of the skin of your head. There were bruises on the right front, the right side, left side, and towards the back of the head.
Was there bleeding associated with those injuries?
Well, the subgaleal contusions themselves were bleeding, yes. There was not associated intracranial bleeding. So there was not bleeding inside the skull itself, no.
Can you explain that a little bit for us? So you just said subgaleal hemorrhage. Is that the bruises in the different areas you were just talking about?
Yes, subgaleal is the more specific medical term for the bruising to the undersurface of the scalp. So, right, there are different anatomic layers between the skin surface and the inside, and as forensic pathologists, we are very precise in our descriptions of where exactly these injuries are. They mean different things, they're interpreted differently, so location matters. Ms. Falzone's injuries were to the undersurface of her scalp. The skull itself was intact, her skull was not fractured, and the skull is removed as part of the autopsy procedure to allow access to the brain. And when that occurred, there was not any bleeding inside the skull itself. There was no intracranial hemorrhage.
We talked earlier about how you document your autopsies, and you mentioned photographs. We're going to go through a series of photos now as we describe the injuries. Are
Okay.
those photos that you took during the course of your autopsy?
I believe those are the ones we're using here today, yes.
And they've been reviewed by you prior to trial?
Yes, I certainly reviewed my own autopsy photos numerous times in preparation for court today. Yes.
So I'm going to put up first State's Exhibit 11 on the screen. Do we see some of the injuries that you've described, the external injuries that you've described to Christine's head here?
Some of them, yes.
And I'm going to put up now State's Exhibit 12, which is the picture on the left, and Exhibit 13, which is the picture on the right. Do these pictures depict the injuries surrounding Christine's eyes that you talked about?
Sort of. The one on the right, that is the bruising around Ms. Falzone's right eye. The picture on the left, the one associated with number 12, that's more showing, and the scale's right underneath, that's an abrasion on the left side of her forehead.
Okay, so that little measuring device there, that's the abrasion above the bruising to the eye that you saw?
Yes, that's bruising on the left side of the forehead, approximately in the general region that I'm pointing to on myself.
And you mentioned a laceration to the right eye. Is this the laceration you're talking about here?
Yes, I described that injury overall as a lacerated contusion. Essentially, it means there's a bruise with a little laceration contained within the bruise, yes.
Would there have been bleeding associated with that lacerated contusion?
I would have expected some bleeding, yes.
So now I've put up State's Exhibit 14. Does this depict the bruise to Christine's left cheek that you described?
Yes, it does.
So now let's move down from the head to the torso, and we will start with the chest. And we'll start with the external injuries. Did Christine have any bruises to her chest?
Yes.
Can you describe that for us?
So on the upper central chest, you could actually even start to see it in one of the photographs, but it's much more demonstrable in some of the other photographs that I took. There's a fairly large bruise to the upper central chest. This one is about a foot in diameter, so 30 centimeters or just under 1 foot in width. So this is a large area of bruising to the upper central chest, but then there are also additional bruises on the right breast, bruising on the right flank, and that's the chest. So I'll stop there.
Now with respect to internal injuries, did Christine also have rib fractures?
Yes, she did.
Can you describe those for us?
Yes, she had rib fractures on both sides. On the left side, the third and the fourth rib were fractured towards the front of the body, and then the seventh and the eighth ribs were fractured more towards the flank. And on the right side, the seventh rib was injured over towards the flank side.
So is that a total of 5 separate fractures?
Yes, 5 fresh appearing rib fractures were identified, yes.
And you just said fresh appearing. What do you mean by that?
Well, I just want to distinguish because I did also identify some fracture calluses, but those were very clearly old rib fractures that Ms. Falzone must have suffered at some point substantially earlier in her life that had long healed up and have nothing to do with why she died or anything that may have happened, in the hours prior to her death.
So you're able to sort of tell by the level of healing you see in a fracture how recent or old it is?
Yes. Yeah, the difference between a fresh rib fracture and a fracture callus it's not difficult to make that distinction at all. They look very different.
And I'm going to put up now State's Exhibit 15 on the screen. Does that depict the large contusion you described to Christine's chest?
Yes, it does.
And could these injuries, the bruise that we're looking at in the exhibit right now, or the rib fractures that we just talked about, be the result of someone even improperly performing CPR?
I don't think so. It was something I considered. There's even a small comment in the language of my autopsy report that's meant to address that. So the lateral rib fractures, the ones that are closer to the flanks, those I'm quite confident saying just no, those can't be from CPR. Similarly, I don't think the bruise is from CPR. I see CPR-related abrasion and, to a lesser extent, bruising all the time. I mean, like literally multiple times a week kind of thing, because so many patients get CPR as part of a resuscitative effort. It just doesn't look like this. Pattern recognition, injury pattern recognition is just such a core part of forensic pathology. This is not what CPR looks like on the chest.
If I told you that a Lucas machine, so one of the sort of automatic mechanical CPR machines was used, does that change your opinion at all?
No. The Lucas device leaves a particular circular type of pattern. There may be a very tiny central region that might correlate to the Lucas, but the more peripheral parts, no, I don't think so.
And is this that sort of circular region that might have correlated right there?
That part could be from the Lucas, yes, but the surrounding part, that wouldn't be from the Lucas, I don't believe, no.
Or traditional
Or
CPR?
an individual using their own body to do chest compressions, no.
So let's move on to the rest of the torso. You started to talk a little bit about injuries to her flank. So what additional injuries did you document on the rest of her torso?
So there were also there were multiple areas of bruising on the abdomen, both on the left and the right sides. Various sizes, all similar aged appearing, but just different size bruises on the left and right sides of the abdomen. There were also various bruises on the left and right sides of the back, as well as the back towards the top, towards the middle, and towards the lower portion of the back. And then there were also internal injuries in the abdomen as well.
So now I'm going to show you State's Exhibit 16 on the left and Exhibit 17 on the right. Exhibit 17 is a close-up image, but do these photographs show the bruising to Christine's right flank and abdomen?
Some of them, yes. This is some of the injury to the right flank, and to a lesser extent, you can kind of start to see some of the right abdominal bruising as well.
And in the close-up picture here, it looks like we sort of have two distinct lines of bruises here. Is that consistent with a pattern injury?
I described this, I believe, I think the specific wording I used was vaguely patterned or something to that. Yes, vaguely patterned. That is the wording I used. It certainly raises that suggestion. It's by no means a definitive example of a patterned type of injury, but it raised that question as I was doing the examination and as I was reviewing my examination photos and putting together my autopsy report, that it may well be a patterned contusion.
And what is a pattern?
A pattern contusion, that's just a term we forensic pathologists will use when there is a bruise or an injury that we think reflects what caused it. So a really overt example might be if a pedestrian was run over by a vehicle and you see a tire mark. That would be a patterned type of injury. But there's other types of patterned injuries as well. And this particular injury with the two lines and the clearing in the middle, it is suggestive of a possible patterned injury.
Do you have any idea what type of thing or instruments could have caused that type of pattern?
If it is a pattern injury, it would be due to either a blow with an elongated type of object or the patient being thrown with some sort of force to cause the bruising into say like a countertop or some sort of edge. I could see either of those things causing this type of patterned injury, possibly.
And just for reference on State's Exhibit 16, which is the one on the left, just to orient the jurors, is this Christine's right leg here?
Yes, that's her right thigh.
And then this is her abdomen?
Correct.
And we see some of the contusions to her abdomen here.
Yes, some of them are visible in this photograph.
So now I'm going to show State's Exhibit 18 and 19. Do these depict additional bruises to the top and the left side of the abdomen?
Yes, these are the kind of low magnification type photographs I take that are meant not so much to highlight individual injuries, but to show an overall distribution of where the injuries are on the body for sort of clarity and anatomic reference of where they are, not so much to focus on any one individual injury like you see in those higher magnification photographs with the scale.
And we can see in this photo here on the left, State's Exhibit 18, Christine's stomach is clearly distended. Is that a result of anything other than her pregnancy?
I don't believe so, no. I believe her abdomen looks this way, this very protuberant state, because she was pregnant when she died.
You mentioned a little briefly ago, she also had contusions to her back. Can you describe that for us?
Yes. So, like I said, there's a bruise. There's a bruise to the left side of the upper back, the right side of the upper back, the upper central back, the right side of the middle of the back, and the left side of the lower back had 2 discrete bruises.
After someone dies, can something called lividity occur?
It can and generally does.
What is lividity?
Lividity is just the postmortem settling of blood after a person dies, right? After somebody dies, you don't have a circulating heartbeat and physical forces start to take over. So gravity will take over, and whatever part of the body is dependent, blood will start to pool in that part of the body. And that is something we forensic pathologists call lividity or livor mortis, to use the more Latin term.
So I'm going to show now State's Exhibit 20. Do these depict the injuries to Christine's back?
The injuries are visible. There's also other findings visible, but some of the bruises that I've described are visible in this photograph, yes.
Do you see any lividity in this photograph?
Yes, there's some lividity present as well.
Can you tell us the difference between the lividity you see and then the actual bruises?
The lividity tends to be the somewhat lighter pinkish appearing material. So like in her right flank, for example, and on her right thigh, that's just lividity. That's not injury.
That would be sort of this area?
No, further down in the photograph. No, further down.
Okay.
Keep going down. No, down like that kind of stuff. That's just lividity. But if you look behind the right shoulder, for example, there's a darker area that's more concrete, more isolated. That I don't believe is lividity. It's a contusion.
And all this that we see to the upper back, are those all appear to be contusions?
Not all of them. No, some of it is lividity. Some of them are contusions.
Did you also document injuries to Christine's arms and legs?
Yes, I did.
And we'll start with the arms. What did you observe on her left arm?
So there are lots of discrete bruises to the extremities. I'm not sure, do you want me to try and go through all of them or just give more of an overview?
Please go through all.
Okay. So on the left upper extremity, there's bruising at the front of the left shoulder involving the left arm. So that's the area between the shoulder and the elbow. I documented approximately 10 individual bruises. There were also 2 bruises to the left forearm, so that's the region between the elbow and the wrist. On the front of the left forearm were 2 bruises. To the back of the left forearm, there are around at least 5 discrete bruises. And I say around or approximately is because sometimes you look at a photograph and it's hard to kind of decide where exactly one bruise ends and the other one begins. So that's why I'm using that kind of wording. I wouldn't get too caught up in precise numbers. So on the palm of the left hand, there's an area of multiple bruises. I counted around 4. And then on the back surface of the left hand, or the dorsal side, I document 8 discrete different bruises, just involving different parts to the back side of the left hand.
So I'm going to show you now State's Exhibit 21, which is on the left, and 22, which is on the right. Do those pictures depict the injuries to Christine's left arm that you just talked about?
Some of them, not exactly the left arm, but the left upper extremity in general, yes. So the picture on the right, that's clearly the forearm, because I can see the hand. So, but these are representative photographs of some of the contusions involving the left upper extremity, yes.
And now we're looking at State's Exhibit 23 and 24. Do these photographs show some of the injuries to her left hand you talked about?
Yes, they do.
Dr. Weinberg, what are defensive wounds?
Defensive wounds or defensive injuries are a concept that forensic pathologists will think about, whereby an individual has injuries to certain parts of the body that often are sustained as that individual is trying to defend him or herself. We tend to see them in the context of either blunt force trauma cases where somebody's being assaulted and there is just a human instinctual reaction to try and protect more core parts of the body by using one's extremities to shield the blows. But we also sometimes see these kinds of injuries, and to be clear, that's not what we're talking about here, but in the context of sharp force trauma cases, where if somebody is being attacked and stabbed, the same idea takes hold, that the individual will try and use their extremities, often their upper extremities, to shield more critical parts of the body, right? I mean, it's worse to get stabbed in the neck, for example, than the forearm, that kind of thing.
Could these injuries to Christine's left hand be consistent with defensive wounds?
Some of them, yes.
Okay, which ones?
Well, certainly the ones on the dorsal surface, so the backside, those very well could be. That's a very common, but I suppose the palmar surface as well. I mean, there's nothing stopping an individual from turning the forearm and the wrist 180 degrees, such that the palm could be. So it's not specific for that kind of injury, but these injuries certainly could be defensive in nature, yes.
So let's now talk about the right arm. What injuries did you document to Christine's right arm?
So it's going to be very similar, just slightly differing numbers, but essentially it's the same sort of thing where there are numerous bruises extending from the shoulder all the way to the hand. The arm itself has 3 contusions. The forearm, on the backside, the posterior of the right forearm, I document 2 separate contusions. On the wrist is a bruise, and then on the right hand, about 5 discrete bruises. And on the right side, they are all primarily on the back side, not the palmar side.
So now I'm going to show you State's Exhibit 25 on the right and 26 on the left. Do these show some of the injuries to the right arm you just described?
These are some of the injuries to the right upper extremity, yes.
And now State's Exhibit 27, does this picture show some of the injuries to the right hand?
Yes, this is a pretty good photograph showing the injuries involving the outer, or the back, the dorsal surface of the right hand.
And again, could the injuries to the outer portion of the right hand be consistent with defensive wounds?
They certainly could be, yes.
Did you also observe injuries to Christine's left leg?
Yes, there are additional bruises involving the left lower extremity, yes.
Can you describe those for us?
Yes, on the front of the left thigh. So when I say thigh, I mean the region between the hip and the knee. There are 3 bruises. And then on the front of the left leg, when I say leg, I mean the portion of the lower extremity between the knee and the ankle. There are approximately 10 abrasions and contusions on that front of the left leg or left shin kind of region. And additionally, on the back of the left leg, so like the calf kind of region, is another bruise.
So I'm going to show you now States Exhibit 28 and 29 up on the screen. Do these photographs depict the injuries you described to the left leg?
These are some of the injuries involving the left lower extremity, yes.
And the jurors have heard a little bit from sort of emergency medical personnel about what an IO is. Is that this little yellow tab right there?
Yes, that's an intraosseous catheter. It's essentially a needle that gets drilled into one of the bones in the leg. It allows paramedics to get rapid access to the patient's vascular system to give medicines, because getting an IV is slower. This can be done very quickly, is my understanding.
So that's something that the EMTs would have done. That has nothing to do with your office.
Correct. That was present when Ms. Falzone came into our facility. I'm quite sure it's treatment related. And honestly, at this stage, I sort of mentally just subtract it out because I know it's treatment related findings.
And now I'm going to move to States Exhibit 30 and 31. Do these photographs depict injuries you documented to Christine's right leg?
Yes. Now these are some of there were a few injuries as well on the right lower extremity, and these photographs document that along with the presence of the intraosseous catheter in the upper right shin.
So for all of the bruises that we've just covered head to toe, did each of those come with at least a degree of associated blood loss?
Yes.
And during the internal examination of Christine, did you also discover she suffered from internal bleeding?
Yes, she did.
Can you explain that for us?
Yes. So after completing the external portion of the examination, I proceeded to the internal portion. And that involves incisions dissecting into the patient's torso for the purposes of the examination. And immediately upon entering the abdominal cavity, I realized there was blood present. The medical term for that is hemoperitoneum. That is not normal. That is not supposed to be there. And the total volume that I ultimately collected and documented of free blood in Ms. Falzone's belly was 500 milliliters. I use metric measurements, but 500 milliliters of acute blood in the abdominal cavity.
Are you able to quantify that for us in any way? I mean, how significant is 500 milliliters?
It's a decent volume of blood. I mean, just for, I guess, comparison's sake, think about a 500 milliliter bottle of water that you would buy at the store. That size vessel was completely full of blood, of free blood that was in the abdominal cavity. It's not, a massive volume. I certainly have seen more in other cases, but it's not an insignificant volume either. It's a significant blood loss in my opinion.
Do you have any way of estimating what Christine's total blood volume would have been before she died?
Somewhat. There are calculations that can be done based on a patient's size that allow for an estimate of a patient's total blood volume. And I did do those calculations in my preparations for trial for this case.
So what approximately would Christine's total blood volume have been?
So the honest answer is I'm not sure. And so I did the calculation two different ways. One, I did just based straight on her weight, not accounting for the pregnancy. And that calculation comes to approximately 4 liters. So think of it, right? A 2-liter bottle of beverage, 2 of those was her total blood volume in that calculation. However, Ms. Falzone very clearly was pregnant, and there are alternative calculations that should be used in pregnant women. And when I put those numbers into the calculators that are out there for this kind of calculation, the total blood volume comes to approximately 6 liters.
So 500 milliliters for, using the calculation, the higher calculation accounting for pregnancy would be a little less than a tenth of her total blood volume?
Correct, yes. Just of free blood in the abdominal cavity, to be clear. That is not what I'm saying is her total blood loss from the injuries.
So just pooled sitting in her abdomen?
Correct.
Did she also have bleeding into the soft tissue around her abdomen?
I wouldn't call it around her abdomen. I would say within her abdomen, yes. So without getting too detailed into the anatomy for various reasons, there are soft tissues internally that we have, and when they are injured, blood will collect in and around those soft tissues. It's not, you can't measure it the same way you can free fluid, right? With the free fluid, I literally am able to put it into a measuring vessel and get a measurement. When there's blood loss into tissue, it is much, much more difficult to calculate the exact volume. It's not possible as far as I'm aware. But in this case, there very clearly was additional significant bleeding into the soft tissues within Ms. Falzone's abdomen.
So based on everything we've discussed so far, all of the external bruises you observed, the internal to the head, the internal to the abdomen, what was the mechanism of Christine's death?
I think the most likely mechanism for why Ms. Falzone died was blood loss in this case. The rib fractures wouldn't have helped, but rib fractures generally don't kill you that quickly. So I'm skeptical that would account for the mechanism. But given the totality of findings, I do think that blood loss or exsanguination, to use the medical term, is the most likely mechanism of why Ms. Falzone died.
So just the sheer volume of blood loss across all of the injuries to her body?
The totality of blood loss between the free blood in the belly, the soft tissue bleeding within the torso, and the bleeding into the roughly 100 discrete bruises that I documented on her body. The totality of that blood loss, I believe, was too much for her body to compensate for, such that she died. Yes.
And how does blood loss cause death? Do your organs just stop functioning if there's no blood flowing to them? Not enough blood?
I mean, essentially, yes. Without an adequate supply of fresh oxygenated blood, organs cannot function. The blood carries nutrients and oxygen and carries away waste products, and we need a minimum volume of blood circulating within our vascular system to stay alive. The body can obviously compensate for some degree of blood loss. It's why people don't die every time they have a small cut. But there comes a point for each individual where that blood loss exceeds that patient's body that patient's body ability to compensate for the blood loss, and cardiac arrest takes place.
Are there certain signs you look for while conducting an autopsy that death could have occurred by blood loss?
Yes, in part because the way that clinicians try and figure this out are not available to me. So the kinds of tests that an ER doctor or a trauma surgeon would do to try and figure out that a patient is bleeding to death, I can't do those tests for technical reasons that I don't think are worth getting into. So instead, we forensic pathologists look for other markers that a patient is suffering from a significant blood loss. And that primarily consists of looking for pallor or paleness of various organs and tissues. The kidneys, the thyroid gland, the brain tend to be, in my experience, the organs that most readily demonstrate that pallor at the time of autopsy.
Did you observe those things during your autopsy of Christine?
I did observe generalized pallor during the internal examination in this case, yes.
And we talked earlier about the fact that you could generally date bruises in terms of newer versus older in healing. How did the bruises appear in this case?
The bruises in this case all appeared to be relatively fresh. I did not see anything. I don't have anything in my notes that indicates that I was thinking any of the bruises looked like they were in that healing stage. They all appeared to be fresh appearing injuries.
About how many total bruises did you document in Christine's body?
In the neighborhood of 100.
And that doesn't include the lacerations, abrasions, broken ribs, and internal bleeding?
No, I think I did that count based just solely on what I called contusions.
And in your opinion, with regards, again, to all of these injuries that we've just discussed, are those injuries consistent with an accident at all?
I don't believe so, no.
Why not?
The distribution of these injuries, the severity of these injuries, the temporal homogeneity, i.e. the fact that they all look to have occurred around the same time. This is not what I see when I examine patients that have suffered accidental injuries. As I think I said earlier, pattern recognition is part of what we do as forensic pathologists, and I examine far more patients that have died of accidental trauma than trauma that I ultimately deem to be inflicted. And this is simply not what I see in those patients. There's too many. The locations, there are numerous factors that lead me to that conclusion that this was not caused by an accident, in my best professional opinion.
Did you find any evidence during your autopsy that Christine suffered from any underlying medical conditions that could have contributed to her death?
No, I found no such evidence from the gross examination I performed, which means, i.e. the stuff I saw with my naked eye. I did do a microscopic examination of the major organs and didn't see any signs of significant underlying medical issues. And to the extent that I could obtain them, I did review medical records and saw no such mention of any major underlying medical issues that I believe would have played any role in why Ms. Falzone died in this case.
What about pregnancy-related conditions?
I'll ask you to clarify. How exactly are you asking the question?
So did you find any evidence that Christine suffered from a medical complication caused by her pregnancy that could have killed her?
No. The answer to that question is no. Again, I did not observe anything at autopsy to even suggest the possibility that a pregnancy-related complication may account for why Ms. Falzone died.
Did you see any dog bites on Christine?
I did not see any injuries externally that I thought could be dog bites, no.
So based on everything we've discussed so far, do you have an opinion as to the cause and manner of Christine's death?
I do, and I had to sign her death certificate, so for every case, I have to offer my best opinion on a patient's cause and manner of death.
And what is that opinion here?
In this case, the exact wording I used for the cause of death was multiple blunt force injuries, and my manner of death opinion in this case is homicide.
Now, you don't know what item caused all of those blunt force injuries to Christine, do you?
No, I do not.
Does that in any way change your opinion as to the cause and manner of death?
No, it does not.
Why are you confident the manner of death was homicide and not accidental or undetermined?
As I answered before, I do not think there is even enough doubt for me to say undetermined with respect to manner, which would suggest a possibility that these injuries were, that fatal injuries, to be clear, because that the fatal injuries in this case were accidental in nature. I was told that one of the things I should consider is, could she have fallen or tripped, that she might have been clumsy, might have fallen down some stairs. I've seen patients who have died from falling down stairs. This is not what I see. It is my best professional opinion that Ms. Falzone's injuries were due to inflicted trauma, and therefore, in my role as a forensic pathologist and medical examiner, it is my place to offer a manner of death opinion of homicide.
So now I want to move on and talk about the fetal autopsy.
Okay.
Is that process different than conducting an autopsy of an adult?
Somewhat, yes.
Have you received training on conducting fetal autopsies?
Training and experience, yes.
About how many of those have you done over your career?
Fetal autopsies, you mean?
Yes.
1 to 2 dozen at this point, probably. They're not nearly as common, but between my training and my work experience, it's probably closer to 2 dozen at this point.
And does a fetal autopsy also consist of both an external and internal examination?
Yes, and there's also some extra stuff that you haven't even asked about yet, but yes.
Does that include examining the placenta?
Yes, that's what I was referring to. If available, a fetal autopsy most definitely should include examination of the placenta.
In this case, was the baby male or female?
Female.
During your autopsy, did you observe any trauma to the baby itself?
No, I did not.
Is that unusual that we see contusions to the outside of Christine's abdomen, but then no trauma to the baby?
I don't think that this is a common enough occurrence for me to even offer an opinion of whether or not it's usual or unusual. It doesn't surprise me that there could be some degree of blunt trauma to the abdomen without me also seeing blunt trauma to the fetus or the placenta.
And during your autopsy of the fetus itself, the internal and external examination, did you discover any evidence that the baby had an underlying medical condition that would have contributed to her death?
No, I did not observe any gross or microscopic abnormalities to the baby or the fetus to suggest any medical issue having played a role in fetal demise.
And you mentioned that you also examined the placenta. Can you describe how you do that? What's significant to you?
Well, examining the placenta in a fetal demise case is very important because oftentimes the cause of fetal demise is actually found in the examination of the placenta. I don't think I need to get too into that here because that's more medical stuff. But it's just an important part of the examination, and if the placenta is available, which in this case, of course it was intrauterine, as was the fetus, I examined it. I have an appropriate gross description, and I also took appropriate microscopic sections for exam as well, and didn't see any pathology microscopically either.
So you didn't find anything medically significant about the placenta that could have led to the baby's death?
No, I did not.
Dr. Weinberg, what is maceration?
Maceration is a term that pathologists will use that essentially describes a type of sterile decomposition that occurs when there is fetal demise and then some period of time elapses before delivery of that fetus. So in some cases, there will be a fetal demise, and some period of time will pass, say, a day, 2 days, 3 days, before the products of conception leave the woman's body, whether by delivery through the birth canal or a surgical procedure. When that passage of time has occurred between fetal demise and the fetus leaving the womb, maceration will occur. It is a very sort of specific type of, and I'm going to make quotes here because postmortem is not the right term, but that's kind of what I mean, postmortem type of change. But it's not postmortem because you can't die if you're not alive.
Did you observe any evidence of maceration to Christine's baby in this case?
No, there was no indication of maceration to the fetus in this case, and therefore no indication of any significant passage of time between fetal demise and death of Miss Falzone.
Were you able to determine the gestational age of the fetus?
I was able to determine an approximate gestational age, which I ultimately am opining as a range of a few weeks.
And how do you come up with that range?
Sure. So I take lots of measurements is the simple answer. I take lots of measurements of the fetus externally, internally, and then there are tables, very, very detailed tables in pediatric pathology texts or journal articles or both. And I literally just try to match up, the weight of the liver fits approximately this many gestational weeks. The length of the foot fits here. And then I look at the overall pattern of where those measurements lie. I kind of erase the outliers in either direction, and I then offered my opinion of the approximate gestational age of the fetus in this case.
And what is your opinion as to the approximate gestational age here?
35 to 37 weeks.
So that would be 8 months-ish?
Approximately 8 months, yes, near term.
So the last thing I'm going to show you, Dr. Weinberg, is State's Exhibit 32. Does this photograph accurately depict the state of Christine's baby and of the placenta at the time of autopsy?
After a little bit of cleaning up, yes.
Do you see any evidence of maceration to that baby?
No, none whatsoever.
Do you see anything about the placenta that is significant to you as part of your conclusion?
No, the placenta appeared as a normal third trimester placenta, both grossly and microscopically.
Was that baby viable?
Yes.
And based on all of your findings, what was the mechanism of the baby's death?
Maternal death.
Okay, so in other words, the baby died because her mother died.
That is my opinion, yes.
And did you offer an opinion as to the cause of death for the baby? Is that maternal death?
Again, you don't use that exact terminology because can't die if you're not alive. The term is fetal demise, so I had to fill out a certificate of fetal demise in this case, not a death certificate, or for that part of the case, I should say. But yes, I did offer, I do have an opinion on the cause of fetal demise in this case, yes.
And what is that?
Maternal blunt force injuries.
Do you issue any findings with regards to manner of death when you fill out a certificate of fetal demise?
No, in New Hampshire, the certificate of fetal demise does not have any place on that document for a manner of fetal demise, no.
And despite the fact that you're sort of filling out different paperwork in this instance, is it your opinion that Christine's baby would not have died but for Christine's death?
Yes, that is my opinion.
One moment, Judge. That's all I have for you right now.